I'd like to end with some comments, and I'd like to give everybody an opportunity. And I think maybe one of the things, if there are any last thoughts, but also if there's any advice that you'd like to give to community neurologists who will be dealing with this in the real world, in their communities. Let me start with you, Liz.
So I think really the critical factor here is really early diagnosis. So as we talk about all of the treatments, they all show better effect with earlier treatment. Once the motor neurons are dead, we don't have anything currently that can bring them back. So really having a low threshold to kind of send the genetic testing, to proceed with additional testing, keeping it in the back of your mind kind of moving forward, I think is probably the most important thing kind of going ahead. I think the treatments are all, at this point, very intensive. So certainly nusinersen, because of all of the intrathecal injections, and I imagine that should AVXS-101 get approval, that there will likely kind of be lots of insurance hurdles and other things that may be difficult to do in the community, but really reaching out to the experts that you have around to kind of set up a good relationship, because those are urgent referrals when they come in. Those are the patients that really need to kind of get seen that week, start things moving as quickly as possible. And so really kind of build up those relationships, because some of these things are difficult to do in large institutions like we're all at, and they can be next to impossible to do in smaller places. So I think really working as a team together, and I think we've done this a lot where we have a local neurologist, and then we kind of also chime in, and the frequency of how you work together may change over time, but I think that type of model system for some of these rare diseases can work really well moving ahead.
Yeah, I think when there isn't treatment pending, on the other end, there's a tendency for people to want to have a very complete referral with a lot of workup and a lot of the differential diagnostic testing done. But I think this makes a new generation, a new scenario where, at least in our institution, we have absolutely no qualms about taking referrals with a hypotonic child with tongue fasciculations or decreased reflexes and working them in immediately if people have reach out for assistance with diagnosis.
And when I'm talking, I think if you're thinking about the diagnosis on your differential, you should send testing for it, because it's really become a can't miss diagnosis.
Advice for the community?
Well, I think one piece of advice would be for the gatekeepers, which are the pediatricians. And it used to be that you'd see a hypotonic child and you'd watch for resolution and have a more benign response to it. And I think the education to understand the point exactly that you're making, that hypotonia could be SMA and that should be thought of first. And testing done, and if you're not sure, referral. And geneticists need to be educated as well, because oftentimes I had one child who was told pre-symptomatic, you have 3 copies, you can wait 4 months to get treated. And so education is very important to identify and diagnose early, because we know that there are delays in diagnosis, and that's key. I think the issue of partnering with general neurologists who don't have access to a multidisciplinary clinic is very important, because we can't treat everybody, but we can provide expertise and advice so that they know how to proceed.
Basil, I'd like to look to you for any final thoughts and comments.
It seems that within a year or a little more, we may have 2 or more treatments approved for SMA. But again, there are treatments that will not be cures for spinal muscular atrophy. And therefore, we have to keep in mind that in addition to these high-tech interventions, we have to continue to use rehabilitative measures, which are very important for the patients, but also for the families, the caregivers. And as far as advice to community neurologists, I think that, as Claudia said, they need to realize that there are centers of excellence which actually can treat these patients if they don't have the capacity to offer multidisciplinary care, they should be referring these patients to centers, of SMA centers.
Thank you.
You're very welcome.
I'd like to thank all of the members of this panel who've contributed to this discussion. On behalf of all of us, I'd like to thank you for joining us and hope that you found this peer exchange discussion to be useful and informative. Thank you.